It's no secret that the healthcare.gov website stumbled out of the gate, but we need to remember that the Affordable Care Act is more than a website. The website can be fixed, the website will be fixed. And we also need to talk about some of the ways that opponents of the Affordable Care Act have been attacking the reforms that were made. The Affordable Care Act is the law of the land. It deserves a chance to work. It was passed by both houses of Congress, signed by the President, and upheld by the United States Supreme Court. In 2012, President Obama clearly ran on the health care law. Arguments on both sides were a centerpiece of the campaign. It was essentially a de facto national referendum on the health care reform. Opponents of the law, like Congressman Bill Johnson, continue to use negative tactics of political manipulation in a never-ending campaign against health care reform. Congressman Johnson himself, after 2 years of opposing reform, casting pointless votes, shutting down the government, and working to block funding for implementation, purported to hold Health and Human Service officials accountable for implementation issues. I have some questions for Congressman Johnson. What is he advocating for? The GOP doesn't have a plan for providing access to health care for Americans. Here are a few other items for Bill Johnson to consider. If the health care reform were repealed, what would he say to the over 5,000 young adults in his district who now have health insurance through their parents' plans until the age of 26? Or the more than 15,000 seniors in his district who have received prescription drug discounts worth nearly $21 million since 2011? Or the up to 88,000 individuals in the district who lack health insurance and who now have access to affordable quality coverage without fear of discrimination or higher rates due to pre-existing conditions. Since 2011, over 8,300 consumers in the 6th Congressional District have received insurance company rebates when their insurers spent more than 20% of their premiums on profits and administrative overhead, like executive salaries. What does Congressman Johnson say to those people? What does Congressman Johnson say to the 186,000 individuals who live in the district, including 38,000 children and 76,000 women who now have health insurance that covers preventive services without any copays, coinsurance, or deductibles because of the law? The partisan rhetoric over the issue needs to stop. If even a portion of what opponents say about the law is true, that will come out. The Affordable Care Act must have a chance to work, and members of Congress either need to put their shoulder to the wheel to make it work for their constituents, or work together to find a better way to cover the uninsured, protect consumers from unfair insurance industry practices.